Hello, hello. Welcome to the Infant Provider Challenge. This is our fourth day together. If you have not seen the other days, don't worry, don't worry. They are great in that they build on each other, but they're giving a different piece of the picture each day. So if you're here today, you're still going to get great stuff, and then you have access to the recordings until the end of the week at midnight. So I'm going to go through the weekend. I'll go through the weekend because some people are just popping on today. So we go to the end of the weekend. We have access to the recordings. And today I am going to offer some exciting bonus that I'm excited to offer. There's also a show up live bonus, which is you are getting entered into a drawing to win the foundations part of the consultative neuroplay program, which is $800 value. You are entered each day that you come live to win that absolutely free and to jump in and start learning with us in this cohort. So that's for showing up live. And there's another bonus that I'm offering today. So stay here, stay here. I'm really excited to talk about that. But I want to jump in. I'm going to start with a story today. Um, so there was a story. There is a sorry. There is a provider who I worked with, and she was in a family, in a home, and she was hired kind of as a fill-in care, right? So parents have a perception of what they need. Talked a little bit about this yesterday. And hold on, let me let some people in here. Okay. Ah, they anyway, parents have a perception of what they need, right? So they hired this provider, and I learned this story because we were working together. And she was there, and the baby was in a SNU. Okay, so she was hired for fill-in care as a newborn care specialist. She had a lot of credentials, totally qualified and experienced at her job. And the baby was like 4.5 months old and was still in a SNU. And so she, of course, was trying to broach this topic with the mom and bring it up like, so we really needed to talk about this. This is when a baby is this many months old, and they're attempting to roll. We need to transition them out of this. It's not safe for them. And I don't know what word she used, but the whole point of the story is mom dismissed what she was saying. And mom says, oh, well, then we're fine because my baby isn't trying to roll. So it's all good. So, my point of sharing this before we start today is that although this provider was really experienced, and she had a lot of training under her belt, she didn't have the authority in how she presented it to and when she started the job. She didn't have that view. The mom didn't have that view of where she was going to take that advice from her. She saw her as like a, you're a fill-in. You're supposed to be keeping the baby happy so I can get some sleep and I can rest. Like this was the mom's perception. And so I shared with her as we worked together. I said, you don't have a skill problem. You've learned, you know what you're seeing and what you're saying. It's like you have a positioning problem. And your identity and becoming the provider that families choose without hesitation and that families listen to, that's where your problem is. Okay. Without hesitation of what your advice is. So, yesterday we talked and we wrote an exceptional care statement. A little bit more sorry, another word for that is unique value proposition. So, your exceptional care statement is like your special sauce. So, why would you be hired if there was a room, not a room, like an interview, right? If there was 5 people and they were all trained, they all were a doula, had a certification, maybe they were NCS as well. Everybody seems fairly equal. Why would you get hired for the job that you want, right? So that's what we talked about yesterday. If you didn't catch it, don't feel upset. I mentioned this at the beginning that if you're here today, we're still going to cover really valuable information, and you have these replays. I just extended the replay availability throughout the weekend, so you can have these replays to catch up and watch. Because day one, we covered like, what are you missing? What are you not seeing? And it can be very anxiety causing to be the one in the room with the baby and something's not working right. And the parents ask you and you freeze because you don't really know how to say it. What is going on? You don't know. So there's that. We talked about that Monday, and we got some a neurological lens of what is the baby speaking with their language? What is their body telling you? And then on Tuesday, we got more specialized into how NICU babies need more special, more more care, but like in a specific way. Like, what are they dealing with neurologically and developmentally that also needs to be considered? We covered that on Tuesday, and we talked about some of the primitive reflexes and what's going on when they come on board. And so if you're aware of that, you can be a whole nother level of provider. And I apologize, there's some like obnoxious truck. So it's probably trash truck right when I start teaching. So yesterday, like I said, we created exceptional care statement and why that's important. And we talked about the communication of your skill, of what you can bring, because that perception is truth for the parents. Okay. So those who are here, share with me in the chat something that you struggle with. Yesterday, I asked if anyone had the experience of being with a baby and they knew that something was going on that wasn't right, of feeding. Or yesterday, we mentioned how babies can be asymmetrical in the way that they move their head or their body. So, what's an experience, or let's say, have you had an experience where you noticed something and you tried to talk about it and it didn't really work? Either they were like, oh, the pediatrician says everything's fine, or they didn't accept it. Maybe they got defensive, the parents. And so, you've had that experience. You've had that experience. Let me know. Let me know in the chat. So I'm giving you a little recap so you can go back and you know how all of this is going together. So today we talked about the story of a provider who was in a home. She was called, hired for a fill-in just to give some extra help for the mom to get some rest. And so we talked about that viewpoint. If that's what the parent views you as, they don't view you as an exceptional expert who's bringing this amazing impact to my baby. They view you as an extra set of hands. And so if you're not feeling seen or appreciated, or like that you're bringing this great impact, maybe you're feeling something's missing in your life, why you got into this work. I talk about myself a little on the first day, but I've also specialized in babies, and I come to this work because I was a nurturer as well. Always had a soft spot for children, and helping them to reach their greatest ability, whatever that is for each child. So I've worked with children all areas of ability and disability, and it's always about, for that family and for that child, how can I help you? You've come into my life, reach the highest possible for you. And what is meaningful for that child? I told a story about a little boy who didn't have any friends because he didn't trust his body. So he would sit under the staircase at recess and he couldn't jump in the basketball game. So he came to PT because he was so uncoordinated, and he felt really just shy and not good about himself. And so stuff like that drives me. That's what drove me actually to move into this first year. And if you go watch the replays, I just didn't want you to feel like lost today. But that's what drives all of this. And so there are babies in your care who need you to know this information. And there are babies who need you to be able to step up and not hold back like you're not the appropriate person to talk about this because you were hired as an NCS. I've had quite a few NCSs, very experienced, right? They'll come to my trainings and they'll say, I only work nights. So I don't really know if this is for me. And so my question to that is, these babies, if they're saying something to you and they're communicating through their neurological system, do you really want to not be the one to see that? To not be the one to be able to bring that up and be like, I only work nights. Sorry, it's not for me. Baby, say that to somebody else. I mean, I know that's a little harsh, but I'm making it a little funny, but that's how I feel. I feel like that in my profession, and I feel like if a baby was come to me or a child, any age, and they were trusting me to help them live their life better, that I have a professional responsibility and moral to do everything that I can. And so if there's something that I didn't know, I went and learned that. So then I can bring everything to the table. So we're talking about today, transitioning back. That was a recap for you. Welcome if you're new to me, or welcome if you're just joining today. Please let me know in the chat a little bit about what you do. I'd love to know what you do, and then feel free to drop a link to meet others. Little networking in case you guys have the same specialties or live in the same area. Feel free to drop that in. All right, so I'm not going to keep you too long today, but I want to give you some value. You don't have a skill problem, you have a positioning problem. So we're talking a little today about embodying and becoming this provider that families choose without hesitation. Okay, so the story of the provider, NCS with the SNU, she was not able to make a difference because the mom had it in her head, one, that this provider wasn't, that's not why she was there. She didn't see her as an expert in that area. And so the kicker, the mic drop, I guess, of that story is that the mom said the baby's 4.5 months, but she goes, well, we don't have to transition because she's not trying to roll, so we don't have a problem here. Well, if you're following me, we did have a problem there because a 4.5 month old that's not trying to roll. So the mom didn't realize that she was delaying her own baby's development. Okay, and on day 1 and 2, I explained why that's such a big deal. So she was delaying it by keeping her in a SNU at 4.5 months, but she's like, oh, I can keep her in. She's not trying to roll. So this NCS, who has a lot of experience, wasn't able to bridge this gap and speak with confidence and her expertise, and she wasn't hired for that. Mom didn't see her that way. So she was not able to help this baby. She left the job, life went on. We don't know whatever happened with this baby. But that shouldn't have been the baby's fault, right? The baby's missing out on something because possibly you as a provider don't feel you're the one to broach an issue, or you're not really sure what to say or how it's going to be received. And so we talked about some communication yesterday, and we wrote your exceptional care statement. So if you want to join in with that, I was going to go over some of those today, but I'm going to wait and do that. If you want to book a call with me, I offered a couple spots yesterday and then I got sick from something that I ate. I was starving and then I got sick. So I'm opening up a few spots after the call today. So you can put in the chat as we go on if you want one of those. And the reason is I want to help you own this stuff. I want to help it transfer over to you and what you need. So if you did not get a chance to write your statement, you can do it on the call with me. And if you did, we can go over that together. So I want to ask you something about all of this. How do you feel about, is there a gap between what you know and how you're being seen? Okay, yes or no? Is there a gap, or maybe you haven't really thought about that? To be honest, when a lot of providers I've worked with, they come to me, they don't talk about themselves. They don't think about themselves. They talk about, wanting to bring the best to the baby and the family, which is awesome. We should be that way. But when I say, what else do you want? Do you feel fully seen? It takes you guys, because you're givers, your service people like me. So it takes us a minute to be like, oh, how do I feel about my life, my vision? Okay, so that's why I want to give you some space today that we're going to go there. I want you to have permission to go there. And our lives are so fast. It's like next, next, next. Like we're just skating over the top sometime, and we don't settle in and say, why did I get in this work? What is my vision? Is it to just make a living? That could be good and bring impact to babies, right? um, Support moms through a difficult time, right? Why did you get into this work, and are you feeling that? Okay, so what I'm sharing right now is it's not only about the communication we covered yesterday. It's very important how you share what you can do, but it's also about who you become on the inside when you have, say, a framework behind you, when you have the knowledge. And I'm coming off of yesterday, but I know some of you are new. So when you have the knowledge behind you of what you can impact, I think that lands. I want to check the chat too. So put your comments in the chat. All right, what I've seen is there's probably more. There's two types of providers like you. Infant care specialists, infant providers. So both people care very deeply, and both work really hard. Okay, and both know more than they're given credit for, and I think that happens often. But there's one person that's trusted instantly and gets referrals really easily and is chosen without hesitation. Their salary's higher, they get to choose their jobs. Okay, and the other one is like appreciated, like a helper. Okay, so when you're viewed as a helper, like the extra set of hands, what can happen is some of the things that I see in the chats that are really frustrating. Like they try to negotiate your rate down because they don't understand why you're different. They think you're just there to watch the baby. I recently had someone tell me that the father is a professional football player, and so the mom is stay at home, right? And they were negotiating down her rate. She was $40 an hour, I believe, which to some of you that may be high, to some it may be low. But for a full time, like she's not financially covering her own life, and she's working a lot of hours. So that might sound familiar. Anyway, it's interesting because the family's perception of what they were hiring her for wasn't worth more money, even though he's a pro football player. And I asked her, I'm like, can they not afford $5 more an hour? She's like, no, that's not the problem. So anyway, I use that as an example because I just met this person. We were talking last week. They negotiate the rate down because they don't understand what makes you different. Why are you different? That's your exceptional care statement, your value proposition. Why are you unique? Some people are asked to drive 45 minutes each way for a 4-hour shift, and they don't understand why that's putting you out. They don't value, right? They don't value. And then, they can cancel last minute because something came up. And then when there's something important, they can call the pediatrician, maybe the IBCLC or the chiropractor, not you. Okay. And I'm not saying at all that I'm training you to be all of those things or a clinician. That's not what I said that many, many times already too the other days, but it's not that. It is the knowledge behind the neurological lens that you can see their baby. We went into the moral reflex, so I'll use that as an example. You can see it and you have a solution to help the moral reflex come the way it's supposed to and go away. Because if it doesn't go away, it causes more problems down the line. It causes the brain to be disconnected. It causes the brain to be blocked. We talked about how all the cells are there, but the connection is what is important. And so if you have a primitive thing blocking the connections, then they can't move to the higher cognitive levels. It's not just a wonky crawl. I see the wonky crawls on Facebook, and it's not just that. It's a communication that something is not organizing well. It's just not. And that is a fact from the children and the babies that I saw further down the line. So clinically for 25 years. So the ones that are having these, there's studies out. I don't think I mentioned this. This is a little off topic of what we're talking about today, but it's super interesting. The studies that are out, I'll just be really short about it, is that children who were later diagnosed with severe autism had, I feel like it was 3 movement patterns when they were 4 months old that were consistent, and they had these movement patterns throughout their entire childhood. So if it would have been found or noticed at 4 months old, who knows if that child would have had severe autism, because it could have been rewired, it could have been connected, it could have been seen. And when you have autism, there's a bunch of things going on, okay? But it's a brain imbalance. And I quote the work of Dr. Robert Malalo. He's been publishing research for, I don't know, decades. So the brain imbalance. So my point is, I have a lot of points at one time. I hope I'm not losing you. Am I losing you guys? Or is this making sense? Let me see. Thank you. Yes, Jill, you're in. Okay. I'm glad it's making sense. I do have notes, but then I tend to get passionate and then I tend to share other things. So if I'm confusing anyone, make sure you let me know. Okay. So back into how these things happen, right? Negotiating your rate down, asking you, canceling last minute, or they don't think twice about your time, really, calling other professionals. Check out the other days if you weren't here when I talked about the family that I met in a bathroom, and she had already was seeing one of the top IBCLCs in town and a chiropractor who did CST, and she did something else, I forget. And so it's not that they were bad, it's just that it wasn't the complete picture. It didn't give the complete picture. So they're calling all these other people and they're spending thousands of dollars. I mean, each hour, 200, 250. And so they're doing all of these things. It could be a feeding specialist and then maybe an OT, and then the list goes on, and they don't really know who's going to find the whole picture. There's a missing piece. So when this happens, they don't truly value you, what you can bring. They appreciate you, but this is not a reflection of your worth. It's a reflection of how you're being seen, how you're being perceived in the role. And so how you're being seen is this positioning problem, like I mentioned, not a skill problem. So there's like a helper, helper is a viewpoint. You can see that. And then there's the expert who is treated in a different way because they show up in a different way. Their rate is non-negotiable because their value is clear to them. It has to be embodied. If you need some help with this, embodying what is your value, book one of the calls that I'm going to offer. I have a link coming through. Okay. Families for the expert, they will pay a premium for her presence. This lady I met in the bathroom, she drove over an hour in Houston, but she drove to meet with me at a park. We go to a park because she got to bring all her other children. We made it work, right? It was great. It worked great. But her husband's like, "What are you doing?" She's like, "Don't ask me any questions." She said, "She met me in the bathroom and she's helping me and nobody else could help me." So, I mean, that feeling is what you want. You want to know that you can help and you want someone to go out of their way to see you. They're like, "What do you charge? I'll pay you whatever." Right? Not canceling. They're not canceling on you because it's like, I'm tired, or, I don't feel like dealing with that. Like, no one canceled on me. She drove over an hour to see me. Okay. And this is not a bragging statement. It's I'm helping you see the owning of your impact and your value. So when you understand what's happening and what you're seeing neurologically, and then you can communicate it with clarity for them and calm and grounded authority, you don't have to try to stand out, right? You just are different and it will be seen. The family sees it the moment that you'll walk in compared to the other people that they're interviewing. I have a student now, and I wish she was here because she has a pattern that she has for her whole life. And before she met me, whatever, and I can see it. She doesn't really see it yet. And so she's going through, she came out of it a little bit and then she's going back in it. And what it is she's making excuses of why families aren't hiring her. Just saying she's not finished this training. She began and hasn't really committed to it. She's spinning and spending her time repeatedly doing interviews in the same embodiment that she was in before. So she came out of it enough to say, "Yeah, I want that." And she's not doing the work. She's not doing this shift. And I can see it and I'm coaching her, but I have to wait. I have to wait for her to be ready and for her to see it. Right. So I can't force anyone to, like, "Oh, you just talk to me once and you're going to be amazing." It's a give and take. Like, you show up because you want to be different and you're like, "Yeah, I want to have this neurological lens. I want to be able to stand, know that I am so valuable and not hesitate to speak and to communicate when I see that a baby can't use the right arm the same as the left, or they're in the SNU way too long and it's going to limit their development." Like, I want to speak up. I want to be different. I don't want to be like the other 4 doulas or professional providers that are being interviewed, right? Sometimes a nanny is chosen because the not that nannies are bad, but they'll have less training, right? But the nanny can be chosen because their rate's less, because the parent doesn't see the difference in a nanny and you, right? Excuse me, we're having coffee together. I hope someone's having coffee or tea with me. Um, so then when you change this view of yourself and you have like the framework to stand on, or you believe that it's really, really there. I see your baby differently. I can understand what your baby is saying through their movement, through their lack of movement, through their feeding challenge, through their sleeping challenge. You don't have to over explain yourself to justify your rates, right? And your value. You don't have to over explain. You don't have to compete on the prices because they don't understand why you're different, right? And a pediatrician's office is looking for someone to fill some gaps for them. And I was a clinical physical therapist for a long, long time. I still am. I just focus on this now. But they would need providers who they know have this neurological framework behind them, because sometimes you're limited by insurance and number of visits and all of those kind of things. And so if there are babies being seen, that they know there's a provider network, and they're like, oh my gosh, that would save them. And a pediatrician who the mom has like a lot of questions developmentally and they don't have time. So if they know that there's someone who stands up, right, who knows what they're seeing, and it's not in a clinical way. Go back and watch the other days if you weren't here. It's not clinical. So I know that it sounds like it could be. But if you have a question, type in the chat and I'm available for a few minutes. I'll do some Q&A with you. So you'll start, you stop shrinking in the room like, oh gosh, I don't know how to answer that. Why the baby cannot settle, right? I see parents in groups asking non-professionals, people who don't have any training, and they answer like they know everything. That's definitely a tongue tie. Go get that fixed right away. And it's like, no, you need someone who has experience with the whole baby. I've said this a lot, but I'm saying it again. The baby is not separate. You have to look at the whole baby. Okay. I had in my clinical practice, we didn't call it tongue tie then. It was a short frenulum, right? Sidebar story again, but I think it's relevant. So it was very, very, very rare. For example, we called it oral restriction, right? Tight frenulum. It was very rare. It was like only the children who had cerebral palsy that were already diagnosed and their whole body was a tight mess. And they, had very limited free movement, they were the ones diagnosed with a tight frenulum, and it was like, okay, well, that on the list of things is not primary, right? So it was like, okay, it's just there. And nowadays, I mean, the amount of moms per day coming through the groups, I mean, I'm just in, I think, 2 of them, and I see 3 posts at least daily, maybe more. Does this look like a tie? Does this look like a tie? Do I need to go get this? Oh my gosh, well, my babies, they're fine. Here's a big one. My baby's fine. My baby's feeding really well and gaining weight. I'm just worried about the future implications. It's a fear. It's a fear because it's all over the place. I'm worried that there might be future implications. So what I would suggest is find someone who doesn't just look at the mouth and the piece of tissue. You find someone who looks at the whole body. How is the baby doing? What do they need? What are they saying? Right? If they're saying, I'm awesome, I'm happy, I'm rolling, I'm doing all the things, neurologically balanced, and then they don't need an intervention that's going to cause so much stress and pain and weakness, because as soon as you get something clipped, you have weakness. Okay. Staying on topic, and then I'll answer questions. So you stop over explaining in those things, and you start being chosen more quickly. You're referred more consistently. One of my students now, she said every time someone did the working interview, she was chosen every time. Her calm confidence with babies just stood out. You're valued at a much higher level because your presence matches your expertise. When you walk in, it's like, this is who I am, this is what I bring. I know it's a higher level and higher skill than all these other people who went through the same similar trainings as me. Okay, so again, I'm happy to go over some of the exceptional care statements if we want to work through that. But this helps you is when your language shifts and the perceived value shifts, having a $2,000 package, for example, isn't a hard sell when the family clearly understands you're not just there to hold the baby. It's way more than that. How you hold the baby, how I would hold a baby, like if someone paid me to be a nanny, how I would hold the baby is night and day between how someone else would hold a baby. Night and day. Okay. And it's like reading the baby's nervous system. Like I can identify, oh, is this tight? This is tight. Hold this leg right here. Do the neuroplay, do a sequence with their legs. You got to identify what's happening neurologically. What is this baby's body saying to you? And then when you can use intentional, like science-backed movement, but it's so simple that the parent can do it, but you get to say why this is so science-backed. You're supporting their brain development. You're creating the brain development. You're communicating in a way like you're seeing these amazing things. And it doesn't mean something's wrong with their baby. Yesterday, we talked about some communication language to use. Now, that is a $2,000 service. Okay, not because you randomly said, I want to charge more, because then there's an identity issue, because you have it behind you. Okay, now this $2,000 package, this language, this identity, and the confidence to lead every visit like this is exactly what I help you build inside the NeuroPlay method, the development consultant program. Okay, not just learning what to see, although we do that, not just knowing what to say, although we do that, but becoming a provider who has the credentials. You can stand on them and completely clear on what they are and who you are and what you bring to every baby in your care. Remember, the babies, they need you to show up in this way, right? Up until now in this challenge, we've talked about what you're seeing and what it means and how to communicate it. And that's the beginning of all of this. I mean, I hope that I've given you an amazing, amazing framework. And the full program is where we embody this and you go deeper and you come out the other side having another credential to use and to stand on. Okay. So that being said, before we end, I have a really exciting bonus for this new cohort that's opening. It's opening next Wednesday. Will be your onboarding call, but the full program, instead of 6 months, you're going to get 7. All right. So you have bi-monthly calls with me. You get the complete framework, observation, assessment, advanced sequences, communication mastery, the title, and a community of providers. I'm creating a new community right now where everyone, even graduates, are going to be able to be in. So the bonus I'm offering today, there's 2 bonuses, and one is 7 months for the price of 6. So you get December for free. You get to continue all the way through December. Even if you finish your curriculum early and you're working with babies, I will work through it with you. You get to actually come live if possible with your baby. We work through it like that. Oh my gosh, that was so fun. I did that with one of my early students, and she has gone on to completely rock it and was a nanny. She was not even an NCS. The bonus too, my assistants, my team don't know that I'm doing this today, but I am offering for those who join with me today, 24 hours, personal marketing outreach. I will do it for you. This one, I'm really excited about this because it's going to get me back in the community. So for 24 hours, if you join with me, then I will personally reach out to 2 medical professional offices of your choice. And I will share about the NeuroPlay method, NeuroPlay consultant, what you can do for their clients, but with your name on the marketing. Okay, so it'll be like, Beta in Florida, this is what she can do for your practice. And here's her contact information. Here's who I am. Here's my credentials. This is what she's trained in. It's like a personal introduction from me. And it's like a referral source that adds to credibility. And I'm really, really excited to do this because it just, like I said, puts me out there in the community. And I'm going to do this in Houston for myself as well and people that I'm training in Houston. But in your city, you get to give 2 offices. So pediatrician or a therapy office or whatever you kind of feel strongly where you want to be. I'm going to do that marketing for you. So I am opening up some calls and I have the link for you to join. If you want to join within the 24 hours, you get both of those bonuses. And tomorrow we're doing something different. So the bonus is going to be gone in 24 hours. All right. So today you came in the challenge because you already knew you wanted something. Tomorrow we're going to put the whole picture together. Okay. But if you already know that you want this next level, don't wait until tomorrow. Don't miss this marketing bonus because I can't do it for a high number of people because it's going to be just me and my team and getting this out there to different parts of the country. And so if you know that you want, don't wait. The provider that you're becoming doesn't want to wait. She leads and she's ready to lead. That is what I have for you today. And I am here for you for some questions, comments, anything that you need. And I'm going to drop my calendar link in the chat. Feel free to raise your hand or unmute. I will check the chat if there's any questions. No questions today? All right, those of you who are catching the replay, we're ending the broadcast now. Live people can stay on for a little bit and have some time with me. Watch the replay. Still send me some comments. In your emails, you will get the calendar link as well. So once the spots book up, they book up because I am a mom of two and other things. So thank you for being here today. And like I said, if you're live, you can stay on for a little bit. See you tomorrow.